Okay, let's be real. When your pet throws up, it's terrifying. Your heart just drops, right? You're immediately thinking, is this an emergency? Well, take a breath. We're going to walk you through exactly what to do step by step right now. So, there it is. Your pet just threw up, and your mind is probably going a million miles an hour. Is this a big deal? Do I need to rush to the vet? What you do in these next few moments is actually pretty crucial. So let's figure out what to look for and what your very next move should be. All right, first things first, we have to figure out if this is a real drop-everything emergency. This is hands down the most important part, so pay close attention. Think of this next slide as your emergency checklist. If you see any of these signs, I mean any of them, you don't wait, you don't Google anything else, you get your pet to an emergency vet immediately. Okay, let's run through these because they're serious. Pale, mite, or even gray gums, that's a huge red flag. It can mean shock or internal bleeding. If they collapse or are just super weak, their body is in serious trouble. And listen, if you even think they ate something toxic, like antifreeze, rat poison, or even some of your own medication, don't wait for symptoms to show up. Just go. Vomiting over and over, like more than 3 times, that can cause dangerous dehydration, especially for little puppies or senior pets. That prayer position, where their butt is in the air and their front legs are down, that's a classic sign they're in a lot of pain. And this last one is critical. If they're trying to vomit but nothing's coming up, it could be bloat, where the stomach actually twists on itself. It's deadly. So to be clear, any one of these signs means it's time to go, right now. All right, so if you've gone through that emergency checklist and your pet seems okay, they're stable, they're alert, you can take a deep breath. Now your job changes. It's time to put on your detective hat because the clues you're about to gather are going to be a huge help for your vet. So first clue, are we dealing with vomiting or something called regurgitation? They sound similar, but they're totally different. Vomiting is, well, it's an event. It's active, there's heaving, you can see their whole abdomen contracting. That points to a problem in the stomach or intestines. Regurgitation, on the other hand, is super passive. The food just kind of falls out. There's no effort. It often even comes out in a tube shape. That tells you the problem is likely in the esophagus. Just knowing that difference gives your vet a massive head start on figuring out what's wrong. Okay, I know this is the gross part, but you have to look at what came out. Don't just clean it up right away. The color, the texture, what's in it, all of that is like a crime scene for your vet. It tells a story about what's happening inside your pet. And here's a pro tip. Snap a quick photo with your phone. Your vet will thank you for it. Trust me. So what are you looking for? Well, bright red or pink means fresh bleeding, something happening right now in the mouth or stomach. But if you see something dark and black that looks like coffee grounds, that's actually digested blood. That's a really critical sign because it means the bleeding has been going on for a while, maybe from an ulcer. Yellow or green foam is usually bile from an empty stomach. Not great, but less of a panic. White foam is often just some mild irritation. And of course, if you see a chunk of a tennis ball in there, well, mystery solved. So, you've gathered your clues. Now, let's talk about the usual suspects, the most common reasons why our pets throw up. A lot of the time, the cause is pretty simple. Maybe your dog decided to become a trashitarian and raided the garbage can. Or maybe you switched their food too fast. Even just eating way too quickly can do it. But it can also signal more serious stuff like intestinal worms, a nasty viral infection like parvo, or a piece of a toy that's causing a blockage. And, like we just talked about, stomach ulcers are definitely another big one to be aware of. And this next point is so important, I can't stress it enough. Human medications. Please, never give your pet something from your medicine cabinet, especially painkillers like Tylenol or Advil. Their bodies just can't process them, especially cats. As the French National Health Agency points out, even a tiny dose can cause their organs to shut down. It can literally be fatal, so just don't. Okay, let's shift gears to your at-home action plan. But I need to be super clear here. This is only if your pet has thrown up just once or twice, has none of those emergency signs we talked about, and is otherwise acting totally normal and alert. This is for the mild cases and mild cases only. All right, here's the game plan. It's 4 simple steps. Step 1, rest. You need to give that upset stomach a break. That means no food at all for about 12 to 24 hours. This lets the inflammation calm down. Step 2, rehydrate, but do it slowly. After a few hours with no vomiting, you can offer a little bit of water. The key is little. A huge bowl of water will probably just come right back up. So think ice chips or just a spoonful at a time. Step 3, reintroduce food with a bland diet. Boiled chicken and plain white rice, no seasoning. It's the go-to because it's super easy to digest. Step 4, return to their normal food. Once they're handling the bland diet well, you can slowly start mixing their regular food back in over the next 3 to 5 days. Easy does it.
So we've gone over a ton of stuff, from the scariest emergencies to simple at-home care. But what about that gray area? What about when you're just not quite sure? You're on the fence about whether it's serious or not. What's the one thing you can do that is never, ever the wrong choice?
It's simple. You call your vet. That's it. They know your pet, they know their history, and they can give you the best possible advice for your specific situation. Look, when it comes to a member of your family, which is what our pets are, it is always, always better to be safe than sorry. Just make the call.